Did anybody raise your hand? What was the question you asked? Anybody doing testing? Doing saliva testing? Raise your hands. And okay. Blood testing? Okay. Some? Yeah, good. Okay. Okay.
So that's more, I'm just going to share this real quick.
Share something.
I'm just going to share the stage.
Open
I'm
up.
just kidding. So I spoke, I'm a new lecturer, it still makes me a little nervous, speaker, I guess. And I spoke to 250, 20% dentist, 80% hygienist. I'm used to this group where there's a large percentage that is doing all of this progressive. We're really looking at things, we're looking at the entire body. Maybe 5% of that room knew what I was talking about. So we've got to get the word out, soak up all the knowledge you can from these brilliant experts, and if you have questions, they're the nicest people in the world. They want to help you. You're up.
Thank you, Michelle. All right, thanks. Quick question. How any dentists in the room just stand up? Any dentists in the room? Okay, we got a few. Great. And thank you for being here, by the way. We have a large number of women here. And it always just strikes me as being like, and I love to have an audience full of the women, because some of the women that I know, like Shirley Gudkowski, who was down in the front, and a lot of the progressive, they're really pushing this. And like I said, there's a big meeting where most everybody goes to, but you're all here. Thank you for your passion. Thank you for the time you're spending here. Now I want to teach you how to find the heart disease risk that's missed by most MDs, and it's doable. It's doable, and I want you to do it. I want to create an army of people just like us, just like everybody in this room that's doing this. So let's talk about it. Thank you once again for being at Hot Topics. This is my conflict of interest declaration, and like I said, I want you to be doing this. We got to identify these early risks, and so let's talk about how we do it. Now, so how do I do it? You know, this Valentine's Day, I held a heart risk public event in my office, and some friends came in. I invited a bunch of people off of Facebook. I put an ad. This was an ad in a local weekly paper. And I thought, I'm going to just talk to people, educate them. If they're interested in this, I'm going to talk to them about and I offered some free tests, which I think is always appealing to some people. And then I offered some other tests that were also available for a nominal fee. But first of all, I got to be talking about my family, because these are my kids, and through the miracle of adoption, I've got 4 kids. Best miracle of my life. Give it up for adoption. Come on. So I've got 8 kids, because these are 2 grandkids, and then these are the 2 twins that were born like 2 months ago. So I feel like I got 8 kids now, and that's the greatest blessing in my life. It's just so awesome. This is my father, Dr. Jack Kammer. He founded the American Academy of Cosmetic Dentistry. So that was a big deal. And I never thought I'd get into the academy developing, founding business, but I did, because it came out of a passion, just like it did for him. So my inspiration and my mentor. How many, so we did ask about this, but yeah, touched by cardiovascular disease, stroke, keep the hands up. I mean, it's out there, it's everywhere. Cardiovascular disease, yeah, it's the #1 killer for 100 years, and so it just seems like still seems like we just let it happen. Like, who's really going after it? Who's trying to kick it to the curb? Who's looking for early risk? You could all be doing that. Now, so nobody wants a heart attack, but we always act like we're, I guess it's something people get every once in a while, and then somebody up and dies. That's the term. Somebody just up and died. Yeah, like Alan Thicke, right? He was playing hockey or something, and I mean, there's always somebody. Tony Soprano, that gentleman that played that role, and who was it?
Gandolfini.
Yeah, Gandolfini, James Gandolfini. So let's just talk about this. And this is, see if you know the answer to this. Like, what's the first symptom in 50% of the people that suffer sudden death from a heart attack? What's the first thing they notice? What is the first symptom of that? Yeah, because it's death. So what does that say? What does that alone say? If I didn't say anything else, it's like, well, for half the people,
Silence.
it's silent and it's creeping up on them for a long time. They didn't know. Nobody found it. Nobody was looking for early risk. So they just kept going because the human body is very resilient, very strong, but then all of a sudden it can give out. That's what we're doing with all these tests and all these, that's why we're here, trying to prevent people from needing all of that or going down that road. So we know that inflammation is the root cause of what's contributing to all systemic disease, all the major diseases. So we know it's inflammation. In fact, we know Time Magazine actually pointed it out some 15 years ago. Like it's the secret killer. So in your mind, when you talk about inflammation, now inflammation when it happens and it resolves a situation like a hangnail or an infection or something, that's good. Inflammation can be good. But what's the secret killer? It is chronic inflammation. Inflammation that just won't go away. That's what's killing us. Our bodies can't take that kind of a thing. So, chronic inflammation is at the root of all these diseases, but right for the moment, we're talking just about cardiovascular disease. Okay? And so AOSH is here. We want to collaborate with the medical community because we can help. There's more that we can do. For too long, that's what we've been saying is, the two separate entities, all designed to help people live better, healthier, longer, but they don't talk much. They almost don't talk at all. AOSH is changing that. You'll change that in the room here with the things that you can do walking out of this room and how you can screen for the heart disease risk that the doctors are missing. So here are my, the Gums of Steel Warriors. We've got two over there, Erica and Lonnie, taking saliva and blood tests to find out if you're on fire, if your body is silently on fire with systemic inflammation, or if you've got pathogens in your mouth that could lead to atherosclerosis. Yes, the 5 high-risk pathogens that actually put the fats that are flowing through your bloodstream into the linings of your arteries. And like Dr. Beck said, if we find it here, Brad Bale says it's been going on here in your heart 10 years before that. So let's find it. Let's look for it. Okay, so to walk the talk, AOSH does the Oral Systemic Health Champion Contest. And our very first one was Ellie Phillips, big xylitol, my first xylitol mentor. And so that was back in 2015. Nirvana Lakes is here. Where are you, Nirvana? There she is. Okay, she was our champ the second year. And I love what she says because she strongly believes it's important to know your numbers. She wants to be on this earth. I mean, who digs life at least a little bit? I mean, I kind of do. I really do. I love it, to be perfectly honest. So I want to be here a long, long time. I'm going to try to go to 150. I'm just going to try. Why not? Right? Anyway, but Nirvana wants to be as healthy as she can be for as long as she can be, because she's got a young family, right? Don't you have some kids? And see, I mean, that's the spirit, that's the attitude. You have 4? Yeah. God bless. It's awesome. So, all right. Now, our 2 favorite mentors, of course, with heart disease and the connection that brought us closer to the connection to the pathogens and the study that they wrote, and are Brad Bale and Amy Doneen. Now, Brad Bale, who anybody in AOSH would say is like, oh, Brad Bale and Amy Doneen, they're the 2 best. But Brad said something at his last reunion for all those that have taken the preceptorship. He said, if I could get one test, if I could just get one test to test people on, to check for their heart disease and stroke risk, it would be the CIMT. Just one. Just give me one test. Well, we have that over there today. Now, here's the cool thing. You could all be doing that in your office. Wait a minute. I don't have a 2-year degree. I'm not a sonologist. I don't, well, hold on. You can do a screening. I'll show you how. Okay? And this is where I believe dentistry is going, because why wouldn't we want to do a screening of the carotid arteries if we know that the pathogens that we deal with can actually cause atherosclerosis and cause those plaques to line up in the arteries? So we do the CIMT. Here's me getting one at one of the Bale Doneen preceptorships, and we know that the CIMT, your arteries will age with periodontal disease. That's one of the studies that we know about. So, in my office, oh, hang on, let me go back a second. Let's go back. Okay. So let's just, I never was really sure exactly, before I got into all this, like how these plaques line up in the artery. But this little video shows that plaques are floating through your bloodstream, and these bad pathogens create an environment where they can pass through the lining and start to line up in the lining of the artery. As they fill and fill and fill, it's closing down your blood flow, and also at risk of popping through that cell layer. That's only one cell layer thick, keeping that plaque out of your bloodstream or from causing a clot. So now this is somebody with, I'm going to say, maybe, would you say it's a 90% blockage, right? I've had 90% blocked arteries, dentists in my lectures who say they passed their stress test. Okay? That blocked passed their stress test. So stress test is archaic. Stress test is out. CIMT is in because you can get a picture of that. And you can all get a picture of that too. I'll show you how. All right, so we do these oral systemic testing days in the office, and I believe it's good to get the information to the public and let them know what their risk is. They don't know. This is my mother getting a CIMT at the office, and she needed to know. What I use in the office now, and that this is available to anybody in this room or any doctor or dentist office, is a portable CIMT. This is an ultrasonic sound reader for the carotid. You can see below the surface. It does the same thing, in a sense, as what we're doing over in the corner. Now, they're doing measurements, but this is a great screening tool so that you can, even as a hygienist or a dental assistant, or even any person in America, have one of these set up in a shopping mall or an airport, I don't care where, and start performing a life-saving service. And I'll show you what I found even on Valentine's Day, which was just last week, right? But this is the tool I use. Oh, and by the way, I had it at the last AOSH meeting, and I started doing some screenings there, just sort of testing it out. Since that time, I've done a whole bunch more, getting better at it. Did it on myself. That's me, and this is just me with my iPad, and that device, it uses like Wi-Fi to communicate with or is it Bluetooth? I don't even know. It's all the technical stuff. But it puts the image right on my iPad, and that's me right there, and it's considered okay. It's considered that you want that layer, that carotid intima media thickness layer, that layer there to be like a millimeter or less, just sort of generally speaking. So this tool will allow you to even measure that, and that's mine at a 0.7, so I'm feeling good about that. But let's not get too excited about that. I can't get too excited about that because that's just one measurement. When they do their CIMT screenings, they do many, many more measurements than that, sometimes upwards of 50 measurements to give you a good idea of how old and how inflamed your arteries are, and to see if your arteries are appropriate for your chronological age. This also will show the blood flow. Once again, I have my sharing with you my arteries, because I'm feeling we're close enough that we can do this, right? Take a look at a side of me that nobody really gets to see, but you do. But my family hasn't seen this. So you're kind of a little more special. All right, but that's the blood flow. You can also do it so you can see the blood flow going through there, and then and do those measurements. All right, so let's just look at the side. This is the carotid artery. Now this is sideways because the carotid artery goes up the neck and into the external carotid, and then the internal carotid goes into the brain area on the other side of the face. Now, so if we tip it sideways, this would be the common carotid down on this side, on the left side, and then it splits into the internal and external, okay? So just get used to seeing that Y right there, because that's what we're going to look at now, a picture that I took on somebody that was in my office on Valentine's Day. Okay, so there's a normal one here on the right, and look at the one on the left. Look for that Y. Do you see some... See how nice and open and dark and flowing that is? And you see on this one, there's some blockages, there's some stenosis. Let's look at that a little closer even. That was all done using this little portable ultrasound and an iPad. Now the thicker arteries are inflamed, and you can also find these fatty deposits in the arteries. So as a screen, I'm not going to do the super deep dive that they'll do over there, but I can just, in literally a minute or two, get a picture of this, save it on my iPad, mail it to them, and say, take this to your doctor and get a deeper dive. Okay? So looking at it a little more closely, like there's your trouble right there, folks. Look at how, like that artery is closing off. It's getting blocked, and it's due to those fats in the lining. So there's another bigger picture of it, and it's causing stenosis. But remember, how blocked does it have to be before someone starts noticing something? Well, they might not even notice when it's this blocked. And to look at this person look like any of the people that are in this room, once again, you can't tell by looking at them. So the cool thing about AOSH is we're really promoting these screening tests. And we have the Systemic Health Champion contest, and we do all these tests. And we have got one new screening test we've added to the mix. You heard a little bit about it from Dr. Back. So actually, but we're screening for a very serious disease. These are serious health risks. It's kind of like, it's this. That, my friends, is visceral fat. We didn't talk about visceral fat a year ago or 2 years ago. It's becoming the thing we're talking about now and testing for it because we want to dive in and see how significant is that, what's going on with that. So there's Dr. Bax. Again, I tip my hat to him for his work in that area. Hard to figure out what visceral fat is, but what it is it's not the belly fat that's under the skin. It goes deeper than the abdominal cavity. It's deep, and it's all that flowing in that area wrapped around your organs. It makes your organs work harder. It kicks out inflammatory factors. Makes it challenge your it does havoc with your insulin resistance. So it's a bad thing. Okay, but who's looking for that? Typically, what do they say? They say if you get a waist measurement, and they say I think it's 40 for men, it might be 35 for women. They make a little cutoff there. But it's almost like, well, that's not the bigger picture. Because you don't know how much of that waist measurement is what? Subcutaneous fat? Or how much of it is this terrible, awful, deadly visceral fat? You don't know until you get an analysis. So we're going to throw out that old standard. That's no good. Here are two people with the same waist size, and you can even see by the picture there's a difference. That one person's got more visceral fat, less subcutaneous fat, and then it's reversed. But they both have the same waist size. So what's the medical community when you're generally going for the medical exam? They'll take a little waist measurement, but why aren't they doing a visceral fat analysis? I don't know, but you can all do it. And if you don't own one of those in-bodies, but I think dental offices will start getting them, and I know two that have already. So it's a coming thing. I've got one in my office, and Susan Maples has one in her office, and there's more to come because it's a 60-second test, and a lot of you already had it. But you could, then if you got the money and you want to go get an MRI, that'll work. But that's thousands of dollars. What did your visceral fat scan cost today? Free. All right. They're more common in the CrossFit gyms than they are in the medical office. Okay, great, but the CrossFit gym doesn't even know its critical importance in the medical world. They're just trying to help people get lean muscle mass and lose some fat and maybe get, they're all they're not necessarily looking or caring about the visceral fat like we do. So we got to get collaborating with the CrossFit gyms as well, okay? Here's another way you can determine your body fat. Who wants to jump into that vat of cold water? I don't. So the in-body is here, and Bradley's here with the in-body, and it's a high-tech way of analyzing your body. It'll tell you your water weight. It'll tell you how much extracellular water you have. It'll tell you how much intracellular water you have. It'll tell you your lean muscle mass. And it's even more information than that. But I just, for starters, want to know what is that visceral fat level. Because at a certain level, it's putting you at a much higher risk for heart disease and stroke. And it's not an unhealthy level, which basically it's a level 10. If you're at a level 10, you are in trouble. Not such trouble that you can't do something to fix it, but you better start doing something is sort of the message that we want to make clear here. And even patients that have had super high visceral fat levels of maybe upwards of 20, they can bring it down, and that's where all of that intermittent fasting, nutrition, and it's 90% what you're putting in your mouth, folks. Okay? So even at the CrossFit gym, if they're trying, I mean, they're working on the 10%, but it's great. So check that out. And now the AOSH attendees, we did 187 tests. The average visceral fat level was 9.5. So that tells you that even health professionals are running around with a very dangerously close to at-risk level of visceral fat. So 43% of the attendees had a 10 or over. That's an eye-opener, folks. That's an eye-opener. Then you want to get with a Dr. Bax, who will work with you on your program to reduce that visceral fat level. And he's getting results. So anyway, that's not good. So the InBody is there for that. So now physicians, as much as they'd like to do everything they can to reduce your vascular inflammation, they can't do it without addressing the high-risk oral bacteria. They need us. We've got to help them. And so we've got this report from Bale, Doneen, and Vigorous that put a bunch of all the studies together. This came out about 2 years ago, I think. And we know the 5 high-risk pathogens. We do a saliva test for that. That's the oral DNA test. So we can start putting all of this together and say, well, you've got these high-risk pathogens in your saliva, and you're carrying too much midsection visceral fat weight, and I'm noticing there's some thickening in your carotids. This is in our area. And when I say that everybody in this room can do all of that, pretty soon Walgreens is going to be doing that saliva test, okay? So I'm 100% serious. And so you can screen for these tests. Just if you want to invest in the equipment, that's a significant investment, but it's going to raise your level and your profile in your community. And why not be a heart disease risk reducer warrior, right? Amen. All right. So this is my passion. I've spearheaded all of the AOSH Oral Systemic Champion contests. I would love to create an army of people that are doing this, because we need to talk to each other. We need to start correlating. Yeah, I got somebody with a visceral fat level of this, and their C-reactive protein was such. In fact, when I get to C-reactive protein, I'll tell you what the visceral fat levels were and the C-reactive protein, which is basically your body's inflammatory thermometer. What is your silent inflammation? These are 2 famous people. Well, not famous, but their son is famous. Their son, I think, invented Facebook or something. Yes, this is Karen and Ed Zuckerberg. Ed was a dentist, but now he consults on social media things and those kinds of things. But anyway, very supportive of the saliva pathogen test, and they allowed me to take their picture as they were testing at my booth. I might say I've probably put more people through. It's a bad mother, like Shaft said, right? He didn't actually say it, and I'm not going to say it either. So, but those are bad bacteria. And actinomycetum comitans helps those fats flowing through the bloodstream line up right into the arteries. This bad stuff. The new one is like everybody's got FN. Every saliva test coming back has got FN. I'm actually, by the way, McLennan from the Oral DNA Lab is going to be at our reception tonight, and he says, I'm coming to tell you some new information about FN, because everyone's been asking. I wanted to have it here for you today. I would have liked to have him here today, but anyway, so there's new information, so catch me at the reception, and I'll let you know what it is. We're chatting about it, but it's been an issue. But it's sitting there in the medium risk, but it's a high risk one according to the Bale, Doneen, Vigorous study. So, what are 96% of all at the last testing we did in Vegas, 96% of all the testers had high levels of FN. So, what's going on with that? I know part of it was they started making the test a little more sensitive, but we got to get to the bottom of that, and I'm working on it. Okay, I got you covered. Don't worry about it. But now I want to know, so is there a heart attack in your saliva, right? That's why we want to check that saliva. What pathogens are in there that could lead to atherosclerosis, that could lead to a heart attack? Now I want to know, is there a heart attack in your blood? That's why we do the blood. That's why we take put the 4 drops on the card and study it and see what the C-reactive protein level is and see if there's an A1C level that's out of control. Is there a heart attack in your blood? So we do the 2-for-1 screening. We do that at AOSH. We do that in our office. We do that in our oral at our heart disease risk forums that we put on for the general public, because they don't know about this stuff. When they learn about it, they want it. When you're the one teaching it to them, they want to come see you, and you, and you. Because you're taking dentistry to a whole new level. So you can get the test here if you like. There's my warriors again, they're doing it. C-reactive protein, if you don't understand it, just in other words, it's like taking the systemic temperature of your body. Is there high inflammation going on in your body? Is your body quietly on fire with inflammation? That little blood test will tell us. And all you got to do is get a 3, and that puts you at high risk for heart attack. Okay? We've seen levels way even. So the highest I saw was probably in the 60s. But it's not uncommon for us to uncover people that are like triple or quadruple high risk for heart attack. So of the ASH members, we had 41% of them were silently bodies on fire with inflammation. That's of all the people that tested in Las Vegas at the last ASH meeting, 41% had a 3 or higher. So it's so common. I mean, of course, heart disease and stroke is the #1 thing is killing people, because we're all running around with bodies on fire. We don't know it, but we're trying to teach it, tell it, show it to people, give them the opportunity to care. Because if they don't get that opportunity to care, how are they ever going to take that personal responsibility for their own health? And that is the biggest problem with America right now. For a while, we did not take personal responsibility for our own health. Oh, sure, we've got all kinds of, hopefully we'll insure them, and we've got healthcare crisis. We don't have enough money to help everybody. But who's talking about the other end? Let's just try to keep people from getting all this disease in the first place. I think dentists and dental teams, hygienists and assistants, front office people as well, can lead the way to a healthier country. Do I believe it with every cell in my body, and that's all of you. So, diabetes, we've heard about the crisis that we're having, so I won't talk about that. But I will say that when we test for A1C, that's another cardiac risk factor. If you've got, if you're in the pre-diabetic range or diabetes range, we want to know your A1C just because of the heart disease risk. So, we've got the world's health in the palm of our hands. In many ways, we can do it now. We can do saliva tests. We can keep people get their periodontal disease under control. But there are a couple little things we can even add to the picture to steer them away from, give them the opportunity to take personal responsibility for their own health. I try. I'm not perfect. We try. We're not perfect. But we're real, and we care, and we want to help our brothers and sisters do the same thing. So let's change the world. It's 2019. Is it time to get aggressive and help reduce those risks of heart attack and stroke? I say yes. Yes, thank you. So we know our bacteria can kill you. Thank you very much. Get a CIMT. Oh, and I think it's break time right now. So this would be a great time to get an in-body or